Welcome back into Talking Fitchburg. Joining today from Fitch-Rona EMS, it's Deputy Chief Jeff Doslick. Jeff, welcome back to the show. How you doing?
I'm doing great. Thanks. Nice seeing you again.
Hey, long time no see. We've got a lot to talk about today on summer emergencies talk. We kind of started this discussion with heat safety last time, but wanted to pick up on other areas in the trauma side. Maybe talk about a little bit about the poisoning. You got a little bit of everything that can happen during the summer. So we're going to try to get to as many topics as possible here with going. First one, let's just hit it. It is a biking community, and you guys have bike medics, which are awesome. Got to see them in action, by the way, a few weeks ago. They did a great job. Biking safety and just some general emergency stuff that come with biking. What would you have for safety tips on that front?
Sure. So obviously the biggest one is wear a helmet. And if you're an adult, wear a helmet when if you insist that your children wear a helmet while they're biking with you, put one on too. And I've seen, over the years that I've been doing this, I really don't see a lot of people not have helmets on unless they're just reckless teenagers. And so wear a helmet when you're out biking. Obviously for the little kids, it's just because it makes me cringe when I see it, because I know what those injuries are: elbow pads and knee pads and things like that. My grandchildren get mad at me because I tend to lean on, like, okay, we're going to put a cage around you when we go biking so you don't get hurt. Bike helmets are the biggest thing. Just be aware of the safety when you're riding, that some cars can't see you, and getting not paying attention, so you're going through intersections and they're turning and they're not looking out. So just be aware of your surroundings is really the biggest thing with bike safety for me. Types of injuries, we obviously see fractures and head injuries, and a lot of scrapes from those falls that happen on bikes.
All right. Well, I'm with you on the biking safety and the kids. When my kids get on the bike, I want to put them in like bubble wrap, because the swerving that they do, and they like to test the limits, but they don't know what the ouchie is. So that's all part of it, certainly. Moving on then, another, I think, big one for a lot of people, and me, and I freak out when I see them, but bees really stand out, and we love the bees. We need the bees, but certainly bee stings can affect people different ways. So if somebody is stung by a bee, first let's just talk on the well, you're stung, now what? And then if you're stung and you do have an allergic reaction, a significant allergic reaction, then what do you do?
Bee stings and wasps, and those little critters that are out, especially when it gets warm outside, and we rely on them to pollinate the world, right? And so just being aware that there's a potential, especially if you're going to be playing out in your garden or those types of areas. For those that are just stung by a bee and they don't have any of the big allergic reactions, it hurts. I don't like it. It happens. You can clean it off and try to get the stinger out if the stinger is still in there, and it just takes a little bit of time, and the pain eventually goes away. For those of you that are allergic to bee stings and carry an EpiPen, I highly recommend, and most of the people that have those EpiPens have them with them all the time. But I highly recommend that you carry them, especially this time of year, like today, where it's nice and warm. You go for a walk or you go down a trail somewhere, don't leave it in your car, put it in your pocket, and carry it with you. Certainly those can be life-threatening emergencies, and if you have to give yourself an EpiPen because you're having an allergic reaction, 911 should be contacted, just to make sure that we can get you to the hospital if necessary. Some of the other little bug-related emergencies, I don't necessarily know that mosquitoes are emergency. At least for us, it might be an emergency if you're trying to kill them, and it's their emergency. But you get lots of little bugs in the grass and things like that, and just making sure that you clean those things up at night. And if it starts to irritate your skin and you start itching a lot, that you make sure it's clean and put some anti-itch cream on there to try and stop it. They're irritating. They're not so much big emergencies, but the bee stings for sure definitely are something that you should be concerned about.
All right, sticking along some of those lines, just poisonings, or maybe you got food poisoning or food allergy, or the different couple different emergencies there. But if you're looking at different things in summer, what would you look out for potentially?
Yeah, so the biggest things that come to mind for me: poison ivy, poison oak, sumac, especially if you spend a lot of time outdoors. If you take those steps to make sure that you're wearing, clothes that can protect your skin from some of those things. Typically not a big emergency, but it can be, especially some of them can be, if you've gotten into poison ivy, it probably felt like an emergency. Topical reaction. You can treat the illnesses by cleaning it up, putting calamine lotion on it, zinc carbonate or zinc oxide, or things that you can put on your skin. So they suggest always wearing long sleeves and pants, especially when you're going to be out, in tall grass or those areas where poison ivy might just be lurking, looking for you.
This is looking for you or lurking, whichever you said. I think it's
Right,
still
right.
funny. All right. Finally, do want to spend some time in the soft tissue injury burn side of things. We go camping. We certainly do other things that could involve heat. We're getting close to 4th of July, which we'll spend an extra amount of time on that one. But
Sure.
for those burns, maybe not significant burn, but I guess even you could probably describe it better than I can. What would you recommend as far as safety tips? We know that we shouldn't get burned, but if you do,
Right.
the significance of a burn and maybe when to dial 911 versus not.
Yeah. So, we take a look at burns in different categories, from just simple burns to full thickness, first degree, second degree, third degree burns. Those first degree burns are things such as, you didn't put sunscreen on when you were outside and you got that really bad sunburn. It's a first degree burn. All the way to where you've burnt yourself on, a fire pit or whatever, third degree burns or full thickness burns where the skin is charred. And then there's degrees in between. Obviously the first degree burns in the sun, the sunburn type stuff, or if you just happen to quick burn yourself on the stove, or touch something hot that you shouldn't have. Trying to cool that off as quickly as possible, running it under, lukewarm water, maybe a little bit colder than that, and just 15 minutes for sure. You just want to be careful that really anything that's greater than that, especially an airway issue, or your hands, because we use these all the time, that we want to make sure we still have our dexterity. And anything greater than what would be a pretty bad sunburn is certainly an emergency for 911. There's been times I've taken burn patients to the UW, and I don't think it's that big of a deal. It needs to be seen, but and to come to find out, they've spent a couple of days because it involved an extremity, a hands, a fingers, feet, things like that. So anything greater than a good sunburn certainly is an emergency. And we can treat it. We can treat some of the pain management with that on the way to the hospital, and then have them evaluate you when you're there.
And Jeff, you're not too worried about what, somebody waiting. Again, I think I'm glad you described the burn as if it's greater than a sunburn, because you don't care if it's a 1, 2, or 3. You're not looking for that. It's the
Yeah.
emergency in hand. So, I think it's always, I'm always on the person who say side with caution. If you're questioning it, call. If
Yep. Yep.
you can always you don't always have to take the ride. You can call the doctor too. But if you're hanging on an emergency, Jeff, don't be afraid to call 911 in any of these
Right.
scenarios.
Yeah, that's exactly right. That's, first of all, that's why we're here. We want to make sure that the citizens of our community are taken care of. And the sunburns, they hurt and they're irritating, and there's things that you can do with aloe vera lotion and things like that. If it's not a sunburn and it's just a I don't want to say a regular burn, but it's a burn where you maybe touched a hot stove or something like that. That first degree burn, that sunburn looking burn, can be cooled off with water. If it starts to blister, don't pop the blister. Don't put burn cream on anything. Um, just make sure that, if you start to get blisters on your hands, or it's, significant more than just a small spot, just to call, even if you don't call 911, to be checked out at urgent care somewhere. But anything more severe than that, certainly it's painful. Burns are painful. We can do something about that on the way to the hospital, but I don't want people to hesitate on calling, because sometimes those things, even from a provider perspective, they're like, well, that's not really that bad. Sometimes turn out to be worse than we expect them to be. So be aware of your surroundings. Everybody's having fun in the summertime, and that's great. And people are out and about, and all the things we talked about, from bee stings to bike helmet safety, and in an earlier segment, heat exhaustion and heat stroke. It's all kind of being aware of your surroundings. And I'm overprotective. My wife gets mad because I'm overprotective on a lot of things, but I just think that when we sort of lose our perspective on what's going on, that's when we tend to get hurt.
Absolutely. All right, Jeff, thank you so much for your time. I
My
appreciate
pleasure.
it. And we'll catch up with you soon.
You're welcome. My pleasure.
All right, Jeff Doslick there, Fitch-Rona EMS. Check them the Fitch-Rona EMS Facebook page and their website for more information and keeping up with the service. And stay safe out there. That's a message from Fitch-Rona EMS. That should be their t-shirt.
From all of us.
Stay safe. All right, we'll take a quick break. More to come. You're watching Talking Pittsburgh.